I'm going to do the mechanical aids, what is it, vital signs, whatever, blah, blah, blah. I'm going to do this skill. So first, what we do, obviously, BSI, PPE, scene safety. You want to make sure you're good. You have all your utensils and everything that you need for this. So first, I want to grab my oxygen tank. I want to know that it's an oxygen tank. First, it's going to have green at the top. So it's going to be green. It might also say oxygen on there. It will also have an expiration date on the tank somewhere. Usually, if it's new, they'll have a white label here sealing the holes that are there. So you basically just want to check the integrity of this, make sure that nothing's wrong with it, that it's a usable tank. Whenever your hand's not on the tank, you want to make sure that you put it down and make sure that it's away from you and your patient so that you can maintain a safe scene. So after I've done that, I want to be able to get my wrench, my little key wrench for this. I want to open it and close it real quick just to let the debris out of these holes, because you don't want any particles or little small substances going into their nose. So with that, I'm going to put this back down away from me and my patient, and you want to state that multiple times, at least 2 times while you're doing this skill. So once you do that, the next thing would be to check the regulator. And this basically regulates, like the name kind of says, it regulates the oxygen that's inside that tank. The max for an oxygen tank is, is 2,000. And nationally, the lowest is 200. I know for Riverside County, it's 500. And I know for San Bernardino, it's 700 pounds per square inch or PSI. So it really just depends on your county and your protocol. But you want to make sure that you check the regulator, make sure that it's, the integrity is there. You want to make sure that, nothing's wrong with it, make sure there's no cracks. You want to make sure that it's good. You definitely want to check the O-ring. The O-ring is what helps helps it have a tight seal in it. And so you want to check that. Obviously this one's not a good one, but the new ones, they'll have them, and you'll be able to check that. So Dr. Nolet calls the little prongs the male part, and this is when you'll grab your oxygen tank. And these holes right here, aka, would be the female part. So what you'll do is you get it, and you'll put it in, and then you'll tighten. Righty tighty, lefty loosey. You know the deal. You want to get it tight, but you don't want to hammer it, or some people, they'll have their regulator where it's kind of bent because they try to hit it too hard. You don't want to do that. You want to just get it to where it's a nice little solid foundation. So now that we have this on the oxygen tank, now we want to make sure that we get the debris out of the regulator, because this right here can have debris in it as well. So what you're going to do is, now you will turn the oxygen tank back on, if it comes on. Okay. So you're going to turn it on now. Once you turn it on, that means the oxygen is going to lift this regulator back up. It's going to show what oxygen level it's at. So with that, then you will turn it, turn it on real quick, turn it off, and that's just going to let the air come out of here. And so yeah, it's just real quick, turn it on, turn it off, real simple. And then don't do what I just did right now. But make sure when you're done, put the regulator down, put the oxygen tank down. And to be honest, you can leave it like that and just work with all your other utensils and whatnot from there. So with that, let's say that our patient here now needs oxygen. So let's just say that they're not having too much trouble breathing, but they need help. So what we're going to do is we're going to put them on a nasal cannula. Okay. So when you first grab your nasal cannula, you want to pull it out, and then I have 2 here. Well, yep, I have 2 here. So you want to check the integrity of the nasal cannula. You want to make sure there's no holes, no wrinkles, nothing that will be detrimental, as far as not being able to get enough oxygen to the patient. So, and this, you can go up to 1 to 6 LPMs or liters per minute. It gives 24 to 44% oxygen when hooked up to supplemental oxygen. So what I'll do is go away. I'll hook this up, and I'll make sure that I go finger tight. Make sure I go finger tight. I don't have to shove it up there or anything. All right, and so once I do that, I want to turn it on. And let's say, you know, this patient's not in dire need, so we're going to give them 2 liters per minute. So once that's happening, I'm going to make sure that I get it ready. These prongs here, you want to make sure that they're going in kind of curved. And so you want the tip, this part right here, they always say tip to the lip. That kind of helps you a little bit as far as knowing how to put it on the patient. So when you come to your patient, you're going to say, sir, this might be uncomfortable, but this is going to help you breathe. Usually, 9 times out of 10, the patient's going to be okay if they're having trouble breathing with that. So then I will go, like I said, tip to the lip, and the prongs are going into the nose, curving down. I'll go around the ears. Once I'm around the ears, I come down and secure it below the neck. Now, when I close this, I want to make sure that it's finger tight. You know, we don't want to choke them. You can even do 2 fingers if you like. But 1 finger is just good enough to where they can still, where it won't fall off, but it's a good hold there. So, let's say that our patient, you know, is breathing like that, but then for some reason his oxygen level is still not being where we want it to be. So now he needs a higher flow of oxygen. So what we're going to do is, we're not going to turn it off right away. What we're going to do is, we're going to take it off of the patient first. Once we take it off the patient, bring it back over here, turn off the oxygen tank, then take this off, and then once that's off, depending on how severe it is, real quick, so now we're going to put them on what they call a non-rebreather mask. And basically the non-rebreather mask is a mask with a reservoir or a bag at the bottom of it. So what you want to do, same thing that you did with the nasal cannula, you want to check the integrity of the non-rebreather. You want to make sure there's no kinks, no rips, no holes, no nothing. You want to make sure that it's all good. You want to make sure that the mask itself is a good mask and that the reservoir bag doesn't have any rips or holes in it as well. This provides, this goes up to 10 to 15 LPMs or liters per minute. Remember that. Remember the little acronyms or little terms for it, because somebody might say, put them on 10 LPM, and you'll be like, what is that? So make sure you know what that it stands for, liters per minute. And it provides 90 to 99% of oxygen. So this is really good, highly effective. We only breathe 21% by ourselves, so that's really good. So what we're going to do is, we're going to plug it in. Once again, only finger tight. I can turn it to now 10. So once it's on 10, oxygen is starting to flow. What I want to do is, I want to put my finger where the reservoir bag is going to be. And the bag, you want it to fill up at least halfway. Halfway, or at least 3/4. Once it gets there, you can take it off and then get ready to give it to your patient. So what you're going to do is, hello sir, use it. This is going to help you breathe. It might feel a little uncomfortable, but what is it? It's really going to help you breathe. So you're going to put this over them like so. And make sure you're just talking to the patient. Don't lift their head, only if you need to, but it's not really necessary. So once this is on their face and it's really good, you want to, this metal part right here, you want to pinch down on it so that it can kind of keep the shape of their nose or their face. Once it's on there, these 2 strings, you're going to pull them simultaneously at the same time to give it a nice little tight grip so that all that oxygen is going straight into them. Okay?
Keep going.
Okay, so now, say this person starts throwing up. Oh no, oh no. So you're going to turn this patient away from you. I know this is kind of long, but I just want to, I want to give it out in detail. So you want to tilt the head and take this mask off so you can allow them to throw up. Now this is where we get to our suction unit. Turn it on, and you'll be able to see how much it's charged and all the other stuff right here. Some suction units are different than the others. So what you want to do with this is, you want to measure from the earlobe to the mouth is where you want to measure. So I'm going to put my finger right here, because that's how deep I can go into this patient's mouth. So I do that, And now I hold it like this. That way I can move it however I want now and still have my marker. So with that, this hole right here is called a carburetor. And I want to check suction first on my glove to make sure that there's suction, enough suction. And this will show you that you're getting suction on there as well. So with that, on an adult patient, I'm going to kind of open their mouth a little bit. And I'm going to go in, and I'm not going to put my hand over the hole until I get in because I don't want to catch their tongue. So I go in, and I put my finger over the carburetor, and I go in circular motions. For an adult, no more than 15 seconds. For a child, 10 seconds, and for an infant, 5 seconds. And then I slowly work my way out within that 15 seconds. I want to go in and come out within that 15 seconds for an adult, child, infant, depending on how many seconds you're supposed to go for each. So say I'm doing that, you know, blah blah blah, and our patient goes unconscious. Okay, so now we have to open an airway. So I'm going to tilt his head. Right? Now I need an OPA, or an oral pharyngeal airway. So these are your OPAs. You're gonna measure these. So this one right here, this one's too small. So I won't use that one because it's not gonna work. So I'm gonna come over here and I'm gonna measure from the earlobe to the mouth. This one looks pretty good. So what I'm gonna do is, there's two ways you can go in. You can go in at 180 and then turn and then go in all the way, or you can go in, you can open the jaw just a little bit, then you can go in 90. I prefer to go in 180, and then you can go that 90 and then proceed to go in. And it's good because it also serves as a bite block for this patient. So with that, we're gonna hook them up to a BDM. So check the integrity just like the other ones. I'm gonna start trying to go a little faster for the video's sake. And once I plug this in, no, the wrong part. Once this is plugged in, we want to get rolling. So, and this also goes on 10 to 15 liters per minute, but it provides up to 100% oxygen. So then I will come to the patient like so, and I'm going to come around. I want to be above their head while I'm doing this, and I want to do a C grip. And when I do this, camera, if you can come on this other side, right, real quick. I don't want to be on their throat like this. I don't want to do that because that might hurt them. So what I want to do, I want to put my fingers on the mandible. And you see I'm doing the C grip. I'm doing this, and I'm keeping it on there. And I'm even lifting their chin a little bit so that the oxygen can go through as needed. Okay, so let's say this person starts gagging, because you cannot use this if the person is gagging or if they're conscious. So I will take it out. You don't have to twist it out a certain way. You just take it out like so. Once it's out, now they need a nasal pharyngeal airway, or an NPA. This point right here is called the bevel. It goes towards the septum, and the septum is this part of the person's nose. So you want to go down the largest nostril. So once you find the largest nostril, you want to go in, and if you're going in where it's up and it's too hard to go in, oh well, first you want to measure it from the nose to the earlobe. You want to do that. I messed up. You want to do that. So then, if it's too hard, and you're gonna make sure you put a water soluble solution, and it'll be easier. But if it's not going in, then you want to go to the other nostril, but make sure that the bevel is still towards the septum. So then you want to go in like so, and then you want to put it in. And you might find a little resistance. This one might be a little big for this person, or for this mannequin, but it doesn't have any lubricant on it or anything like that. And so we're gonna just work with the best that we can as far as the video purposes. Okay. This one, I don't know. Okay, perfect. So once it's in there, then we're gonna be bagging this person, and you use a NPA whenever you can't use an OPA. You don't use an NPA if you can't if they have facial fractures or anything like that. You don't want to use it because that can go into their brain and that cause a lot of damage. So once that's done, we take that out. Our patient needs a pocket mask. So what we're going to do is we're going to take out our pocket mask. It's going to be real done. So then we're going to go over here, and we're gonna breathe for this patient with the one-way valve. So I'm gonna do this. I'm gonna do the CE grip. I'm gonna head chin lift, and I'm gonna give 2 breaths every 6 seconds for an adult, and then I'm gonna do 3 for an infant. So I'm gonna go. And you see how the lungs lift. So that's how you know it's working. So once that's done, oh, and this gives up to 55% of oxygen, so that's even better than what we normally breathe in just regular. So say your patient is now doing good, he's alive and well, hoorah. Let's finish what we have to do. So I'm gonna make sure that I have this regulator shut off. I turn it off, and I come here, I turn the oxygen off too. So I tighten it. Now that the oxygen is off, there's still going to be pressure built up in here. So what I'm going to do is I'm going to turn on and let all the oxygen that's still the pressure that's in here bleed out. Once it's done bleeding out, I close it, and then I can start taking it out. I twist it. Once I'm done twisting it, I can take this off. I'm making sure that I'm putting all my stuff away from the patient. As I do that, I make sure that it's good. It's away from everybody. Nobody's going to get hurt. My patient is now breathing. That is the airway skill. Also look at your criteria sheet in the binder. It should help. And follow through. I probably missed some things, but that, for the most part, that was it. Boom.